Thank you very much.
Thank you.
I'm going to hand over to Gady now, who's going to come on for the next session. So over to you, Gady.
Thank you, Tom. Thanks, Tom. Hello. I have the pleasure of introducing to you Cecilia Chung from the Transgender Law Center. In addition to her day job, she's also a healthcare commissioner in San Francisco. Before that, she was chair of the Human Rights Commission there. And so she's got several different vantage points from which she can talk about the issues of discrimination in healthcare and LGBT rights in healthcare. And I'm going to start with that word, rights. Is healthcare a right or a privilege?
Okay, well, thank you for asking me that question. I firmly believe that healthcare is a right. And if we want to look at the reason why, we can just look at how healthcare is being provided, whether it's in a socialized medicine country or in the United States. Whether a person have insurance or not doesn't stop that person to seek healthcare. So it's either through costly services like the emergency services or having a primary care providers that can help them to provide costly services. So I believe that it's a right, and it's also a cost-saving policy, when we actually codify that right.
Right, and this is something that, in terms of cost saving, is something you've talked about in terms of even the HIV epidemic 30 years ago, right? Can you address that a little bit?
Yeah, absolutely. For some of us, who are over a certain age, I would say 40, you probably would remember the time when the HIV epidemic was actually taking a lot of lives, in the 80s and the 90s in here, and also it turns into a pandemic that although all the different populations are different in different countries, but there is one thing in common. The delay in healthcare actually make it more unmanageable because we cannot really keep that in check. So when we have all the medications comes out now, we are trying to propose how to create a more rigorous prevention strategies. So that's the part. If Ryan White didn't get sick, we will probably see a delay in adapting these policies as well. But the fact that a white teenager named Ryan White who actually contracted HIV demonstrate that it's not just a gay issue, it's not just a LGBT issue. It's everyone's issue.
Right. So not only should healthcare be a right based on principle, but also just practical, in a practical sense.
Absolutely.
And well, that brings us to maybe not the most practical person I could name today, but Donald Trump, the elephant in the room on healthcare. He obviously has been campaigning to repeal the Affordable Care Act, and also President Obama's executive orders. Now, one of the executive orders is something quite relevant to what we're discussing today. You want to talk about that a little bit?
Yes, one of the executive orders under President Obama was the creation of Section 1557 of the Affordable Care Act, which prohibits discriminations against LGBT people in healthcare, and actually also provide some protections for women who are seeking reproductive health care, including abortions. And so that's actually at risk of being overturned because the president can just use the stroke of a pen and just take that off the law. So the part that I think we really need to understand is that whether Section 1557 is there or not, it doesn't take away our fundamental rights, for healthcare and our entitled to healthcare. But what it does is it invites illegal discriminations to happen, and it becomes costly, court battles. And so I think that if we're really looking at being more conservative and money saving, they should keep it in there to make sure that some of the medical ethics are being adhered to, such as respecting autonomy and do no harm. So I think that there's a lot that we can continue to talk about, but basically if we think in that kind of a scope or that framework, we'll recognize that we should all be really grateful, that we live in America because we have the constitutions that protect all those rights. But it's just a matter of like how long is it going to come to fruition for us.
Right. Well, which brings it, you're especially grateful, if I'm right, to live in California. In terms of as a model for healthcare nationally, I mean, California is often credited with being kind of ahead of the curve on a number of different fronts, but in healthcare particularly, that's also true, right? Talk a little about that, and it's also affected your personal experience. Right?
I would venture to say yes, although like some people might argue that Massachusetts have always had universal healthcare before California, but I think that, for instance, we actually started to provide transition-related care much more sooner than Massachusetts. And the fact that San Francisco actually now provide transition-related care, which includes gender-affirming surgeries to uninsured in the city and county of San Francisco, really demonstrate, why it's important to like meet patients where they're at, because they're more likely to engage in healthcare and they're more likely to prevent whatever disease they have, such as diabetes, HIV, or hepatitis C, to become more advanced. We're seeing that change pretty significantly in the city and of San Francisco, also in the state of California. And I myself benefit from that because I am a transgender woman living with HIV. Had it not because of these like patient-centering healthcare, I wouldn't be sitting here today talking to you about like how I can like show up as a leader in the community. And the fact that I'm now on the Health Commission, there's this huge stake. Yes, I also oversee a $2.2 billion budget under the Finance and Planning Committee, where I chair that committee. So I have a lot to prove, and I hope I'm proving it.
Actually, I wanted to pick up on that and ask what's your wish list in San Francisco? I mean, or what have you recently accomplished that you wish others would copy in San Francisco?
I think that looking at the trans community is a great way to really look at healthcare and also, how to like put in protections because trans community, especially transgender people living with HIV, is a perfect example how intersectional oppression shows up in one person's life. So adding, the gender and the race into that equation, it makes it even more egregious sometimes. Like when people say that, well, that's against my belief system to treat you, because we're not asking them to agree with us. We're just asking for the basic prevention of healthcare and also, the intervention that they went to school for. And that's still an ongoing conversations, I think, between some of the red states who have not adopted Affordable Care Act, as a way that they see as cost saving, but at the end, I'm pretty sure that it's actually costing more money.
Great. We have a few minutes left, and I wanted to give a chance. I can always ask a couple more questions, but I wanted to see if folks in the audience have any questions for Cecilia. Does anyone out there want to pipe in, pipe up, pipe down? I guess. How have you?
The question right there.
Oh, there is one right here. Sorry.
So my question is more on your organization in terms of Transgender Law Center. You're personally based in California. What type of work are you doing, across the U.S. in support of transgender rights? Because there is such a spectrum of where all the states are. So I just want to hear a little bit more about the work that your organization's doing.
Oh, by the way, we actually have an office here in Brooklyn. So it's not just in California. We now have 2 satellite offices, one in the south in Atlanta and one here based in New York in Brooklyn. Or maybe some people argue that Brooklyn is not New York, I don't know. We really make an effort now to look at some of the most marginalized communities that we serve, such as like trans immigrants, documented or undocumented, and the hardship that they face. So because of that, we have created a project called TIDE, which is Trans Immigration Defense I don't remember what the E is. Like so, and.
We'll go with equality.
Yes, yes, and so we're really trying to like make sure that those who are like detained in ICE detentions get the legal representations that they needed. And we recently also went down to the border to help some of the caravan refugees, like to apply for asylums. And many of them are trans women living with HIV. So those are the added stigma that they have to deal with. And in addition to that, of course, we have a helpline that people can call, and we sometimes would refer those clients to pro bono attorneys that within our legal collaborative network that now we're calling it, I think, the Resistant Network. And on top of that, we do a lot of educations in the community. Yes.
Thanks. Very good question. I think I see a question in the back. Go ahead. Two questions in the back. We'll try and get to both of you if they can be quick.
Hi, my name is Jason Ortiz, and I work for S&P Global in Diversity and Inclusion. A couple of us back here were very blown away by the $2.2 billion that you've been able to find towards transgender inclusion. We're just curious, how did you acquire those funds, and what's your vision for the transgender community with that?
Okay, so let me clarify, the $2.2 billion is the entire healthcare budget, not just for transgender services. But it started off as a resolutions that the Board of Supervisors passed to provide healthcare and transition-related care to the employees of the City and County of San Francisco. After 4 years of adopting that policy, we recognized that it didn't break the bank. Actually, our healthcare costs went down for, the insurance costs. And so we know that, this is actually a good policy to have. And so we looked at how to expand that. And today, we're able to, expand that to the entire city of San Francisco, as well as influence, our California legislature to adopt similar policies.
Thank you. And also, she's still building her empire, so give her time. I'm afraid that we did run out of time, but I hope you two can connect right after the panel, and hopefully you can ask your question directly. Thank you so much. I'm now introducing Emma Hogan, who's going to do the next panel, next talk.